What are the tests you should do before an HSG procedure? Before you conduct HSG, there are certain tests that your doctor, your fertility specialist may request that you conduct, all right? It varies. It may not be the same for everybody, depending on your assessment by the doctor, all right? Yeah, but the most important test you must conduct before doing an HSG is pregnancy test, all right? It is because we don't want to conduct an HSG procedure when you are already pregnant. We know that the reason why you are conducting this procedure is either fertility issue or recurrent miscarriage. But you may be having fertility issue, and luckily or fortunately, you could just get pregnant in that cycle. All right. So before you conduct, unknowingly to you or to the doctor, so the doctor has to conduct at least a pregnancy test to ensure that you are not already pregnant before carrying out this HSG procedure. That is because I explained earlier, because the HSG procedure, the procedure involves exposure to radiation, X-ray, exposure to contrast, and the procedure itself can flush and affect a pregnancy that is just developing, all right, especially maybe when you see the fallopian tube moving down, all right, or it's just trying to attach to the endometrium, the inner lining of the uterus. All right? But there are some cases in which a woman may already be pregnant, okay, like almost a month pregnant, all right, and she may see blood flow for 2, 3, 4 days. Maybe they may be very light, with or without mild pain, all right, and she may think she's already having a menstrual flow, not knowing that she's already pregnant, okay, and that can occur for two reasons. We call one implantation site bleeding, or you may be already be pregnant and you're having what we call threatened abortion, mild lower abdominal pain, and some spotting, all right? And you will think it's maybe if it lasts for like 3, 4 days or 5 days, you may think it was your menstrual flow, all right? So we don't want to work based on assumption, all right? We want to conduct this test to know that, yes, pregnancy test was done, it was negative, therefore, and she just finished seeing her flow. Two things to confirm that there's no pregnancy before we go ahead for HSG. All right, that is the first test, the most important test you must do before HSG. Then, in some cases, your doctor may request that you do an ultrasound scan. And it's also an important test before HSG. All right, ultrasound scan will see the outside of the uterus and the body of the uterus, the muscles, okay, to see there are fibroid, if there are any other abnormality in the uterus. Or ultrasound scan does not, although it sees the inside of the uterus, but it cannot tell much about the inside of the uterus. That is why you are doing HSG in the first place, okay? Because the HSG will see the inside of the uterus and the fallopian tube better. The ultrasound scan will see the outside of the uterus. You may see the inside of the uterus, but will not give much information about the inside. Then another test that your doctor may request you do is you may need to screen for infections before doing an HSG procedure. This is not for everybody. After an assessment by your doctor, okay, he may adjudge that you have some risk of having sexually transmitted infections or pelvic infections, okay, which they may ask you to do some particular tests, like taking a swab from your cervix or your vagina, all right, or and also taking your blood sample to check for two major infections, chlamydia and gonorrhea. If anyone is positive, they usually will give you treatment to make sure that you don't have any pelvic infection before this HSG procedure. But like I said, it's not for everyone. So the three tests that may be done before an HSG procedure, the three common tests is: one, pregnancy test, very important. Two, ultrasound scan, also important as well. And then three, screen for infection, pelvic infection. This is optional depending on the risk of the patient.